This week, right, we had a patient and she was concerned about if she should be taking hormones. And there's been some resistance from her primary care physician, right? Can you tell me a little bit about what happened in this particular instance?
Sure. She's a 49-year-old female and is going through perimenopause. So she's experiencing weight gain and has tried really hard to lose weight and can't do it. With her, all the things she's tried with good diet and lifestyle changes, she's experiencing night sweats and increased anxiety. The anxiety was definitely clear in this consult. So much so that she needed to run all the information that we discussed by her physician before considering any kind of hormone replacement. But unfortunately, as I shared with her, is that physician resistance is real. There's a lot of physician resistance around hormone replacement, specifically with perimenopause, because there is no diagnosis or specific treatment of perimenopause. It's really a diagnosis of symptoms where a woman may experience night sweats, difficulty sleeping, increased anxiety or mood dysregulation, increased belly bloat or weight gain. Some women may notice increased dry skin. And the only solutions that conventional medicine offers are hormone replacement through birth control or an IUD, or they'll put this patient on antidepressant. And unfortunately, what does that do? It ends up causing more weight gain and plummeting their libido.
Yeah.
So that's really what we run into often because there is no diagnosis of treatment for perimenopause.
That's unfortunate. I know Dr. Dam talks about this a lot. You guys talk about this a lot, and it seems like women get like an unfair shake in this realm for sure. But focusing a little bit on the physician resistance, like why do you think that, or in your experience, right? Why do you think that is? And I have some thoughts, but like, what are you seeing?
Well, firstly, lack of training and understanding. Women's health has been poorly understood for years. Hormone replacement has been around for well over 50 years, but there's gotten a bad rap with the misreporting of the Women's Health Initiative and scaring physicians and the public about hormone replacement therapy. That's why there can be resistance just on that. But as I said, with perimenopause specifically being a diagnosis only of symptoms, they're not allowed to treat anything else other than those symptoms. So they're kind of stuck treating the depression and giving the person antidepressant, or they're stuck treating some of the mood swings only with oral contraception or IUDs.
That's a good point, right? Because like a traditional physician treating by insurance is kind of bound to certain diagnoses, and I can only treat you for a diagnosis. I can't just treat you to feel better. I can't just treat you for wellness, right? I have to diagnose you with something and treat you for that something. Right?
So insurance will pay for it.
Yeah, that's
and
great.
unfortunately, it misses the boat on the women's actual concerns. And I see that over and over each day. Every woman that tells me, yeah, this didn't help me. In fact, I gained more weight, or I had less libido. And it never treated their sleep. They'll give them sleep aids and they'll tell me initially it helped them, but then now they have to increase the amount of sleep aid they need, which also puts them at other risks for increased insulin resistance. So it is poorly managed currently in our traditional medicine.
Yeah, I think like people don't realize when I talk to people, traditional medical school does not train anyone in hormone therapy. Even like endocrinologists are not like really trained in hormone therapy, right?
That's correct. I had to do hundreds of hours of extra training just for that alone. And so do other physicians that do this hormone replacement. They get extra training for that.
And I tell people that like unless your doctor went and trained for, like, sought this out to train for it, they don't know about it. Like no one's teaching them about it. Right?
Correct.
And I talked to someone the other day, just yesterday, and someone was giving him all this advice about hormones and why you shouldn't take hormones and they're scary and they can do all these bad things to you. And I asked him, I was like, well, how much training has this person had that you're talking to? Do they have research they're showing you? Do they manage any hormone patients? Or have they had any experience managing patients? I was like, before you listen to anyone, ask those three questions. Have you managed patients? Have you had training? where's the research that you're talking? Like, where's the
That's
research
a good point
that
where the
supports
research is. All
what
the
you're talking
research
about?
that we utilize to support this does come from the journals that are for these specialties, the journals of OB-GYN,
Yes.
the journals of menopause.
Like, no one's reading them.
No one's reading them.
Yes.
So, and then again, like you said, what kind of training did they get? Did they get updated on the latest research? We just were discussing this week alone, there's been several articles that have been released that vaginal estrogen suppositories are now okay by the FDA. They've been removing these black box warnings because the pendulum is swinging the other way.
Yeah.
So it is saying, oh, you know, maybe we were wrong about this. Maybe there are good things here. And unfortunately, you know, if women aren't educated on this, and if they aren't seeking for advice and help about their health from physicians that are expertly trained or trained more advanced with hormone replacement, they're suffering.
Yeah, I think we see it. I think we see the tide switching, like you said, like this pendulum swinging the other way. We saw testosterone black box warnings lifted and removed. Now we're seeing estrogen or vaginal estrogen warnings removed, and then many people are overturning the WHI findings. Like, we have people like, is it Dr. Marie Claire, right? That posts a lot. So hopefully it's starting to swing the other direction, because we definitely see every day how
it tremendously benefits.
Tremendously changing people's lives. Not even benefit. I see like, I call it like life changing. Like,
yes.
Life changing.
Yes. I mean, the struggle's real, but the women that have stuck with the process all have benefited.
Yeah, for sure. Well, thank you for your time.
Yeah.